Our next speaker is Dr. Rachel Campbell, who'll be speaking with us about fatigue and brain tumours. Rachel is a postdoctoral research associate at the Psychology Oncology Cooperative Research Group, otherwise known as PoCoG, based at the University of Sydney. Rachel aims to identify and improve the symptom burden and quality of life of people living with chronic disease. As part of the MRFF funded BRAINS program, her research currently focuses on implementing routine screening for psychological distress and unmet needs in people affected by brain cancer and developing tailored supportive care interventions for this population. Please welcome Rachel.
Thank you, Marina, for that introduction, and thank you also to the organisers for inviting me to speak today. So as Marina said, this talk today is going to focus on fatigue in brain tumour, which I'm sure is something that many of you here are quite familiar with. So before I begin, I'd also like to acknowledge the traditional custodians of the lands on which we're meeting today, and also pay my respect to elders past, present and emerging. So cancer-related fatigue is commonly defined as a persistent, distressing, subjective sense of physical, emotional, and/or cognitive tiredness and exhaustion that's related to cancer and/or cancer treatment, that's not proportional to recent activity, and that interferes with usual functioning. And so because cancer-related fatigue is a subjective experience, we don't have objective tests to measure it, and so it can be more challenging for healthcare professionals to identify. And so we assess fatigue using self-report measures, which ask patients to questions about their fatigue and to rate their fatigue and different aspects of it on rating scales. And so fatigue is the most common symptom that is reported by people with primary brain tumours. So between 39 to 77% of people with low-grade gliomas report fatigue, and around 40% continue to report fatigue up to 8 years after completing treatment. And among those with high-grade gliomas, around 48% report fatigue, and around 94% report fatigue following a tumour recurrence. As we can see, these prevalence rates are extremely high. So there are many factors that can contribute to fatigue in brain tumour, and it's generally thought to have multiple causes. So the brain tumour itself can cause fatigue due to the metabolic demands of the tumour, and also because the tumour can interfere with brain functions that regulate energy, sleep, mood, and cognition. And then fatigue can also be exacerbated and made worse by treatments for brain tumors like surgery and radiation therapy, chemotherapy, and medications, including steroids and anti-epileptic drugs, so all of these can exacerbate and induce fatigue. And then there are many other factors which can contribute to fatigue, like cognitive difficulties, seizures and other brain tumor-related symptoms, the emotional impact of being diagnosed and treated for brain tumor, sleep problems, and also lack of physical activity. And so our research group, which is based at the University of Sydney, conducted a study to examine the experience, impacts, and management of fatigue in people with brain tumor. And we did this by carrying out interviews with people with brain tumour, with their caregivers, and also with healthcare professionals who care for them. And there were three sort of main themes that came out of these interviews, and these focused on the pervasiveness of fatigue, the impact of fatigue on lots of different aspects of daily life, and also the self-management strategies that people use to try to manage their fatigue. So with regard to the pervasiveness of fatigue, and many of the participants that we spoke to talked about fatigue being an almost universal symptom. So it was something that was described as, nearly all patients would report it at some point from diagnosis and treatment. So for example, one healthcare professional that we spoke to said that it's something that comes up with every patient in nearly every single consultation. Many people that we spoke to also talked about fatigue continuing long after treatment had ended. And for some, this long-term persistence and also the severity of their fatigue came as a big surprise and was quite unexpected to them. And then similar to that definition of fatigue that I just took through at the beginning, many of the participants that we spoke to described different physical, emotional, and cognitive aspects of their fatigue. And so I just want to show you a video, which I hope you will be able to hear. So this is a video that we created based on these interviews that we conducted with participants. And I think it gives a really good demonstration of how the participants that we spoke to experienced their fatigue.
It's been a really hard time because I felt sick, often get headaches, and feel very tired. And it's a really different type of tiredness. I might not look tired, but I feel really worn out. When I'm tired, it messes up my brain. My brain already struggles, but fatigue makes it worse. It makes my mind feel foggy and clouded, and my body won't do what I want it to do.
So I think that, as I said, provides a really good example of the sorts of things that we were hearing from the patients that we spoke to about how they experience their fatigue. So as I mentioned, also many of the participants that we spoke to talked about the impact of fatigue on really diverse aspects of their day-to-day life. Actually, I think we've gone one. So for some of the participants that we spoke to, they talked about fatigue making their brain tumor-related symptoms worse. And this was particularly true for the cognitive difficulties that they experienced, so with concentration and with being able to remember things. And then others talked about the psychosocial impacts of fatigue, so on their own mental well-being, but also on their relationships with others. And this was often described as being because they simply lacked the same energy to spend the time with the people that they cared about, and this could then cause, tension within their relationships with others. And then a lot of people also discussed the functional impacts of fatigue, so particularly in terms of needing to reduce or stop work or study, generally just having difficulties doing their usual everyday tasks like the grocery shopping or cooking and cleaning. And then others talked about finding it really difficult to enjoy the activities that they used to enjoy doing, like their hobbies and leisure and travel. So many people that we spoke to talked about developing their own strategies to self-manage their fatigue, typically through this process of trial and error, where they would try out different things and try to identify things that would work for them. And so many of the people that we spoke to talked about general lifestyle changes that they made. So this included things like increasing their physical activity and their exercise, making changes to improve their diet, trying to improve their sleep habits, and then also practicing mindfulness. And then others that we spoke to talked about it being really important to try to accept their new normal. So particularly trying to accept the new limitations that they had, and really needing to take efforts to balance their energy by having a regular routine and by planning their activities very far ahead of time. And really they described a need to be very intentional with how they use their energy, and they talked about needing to build in periods of rest after any periods of activity. And then lastly, others talked about the importance of proactively seeking social support and information. So in particular, communicating their needs to their family and their friends and healthcare professionals, and asking for the help that they needed from others. So in terms of management approaches for cancer-related fatigue, there are two main management approaches that have been examined to treat fatigue. The first is pharmacological approaches, where drugs or medications are given to try to treat fatigue, and then the others are the non-pharmacological approaches that don't involve any drugs and medicines. And there are four main types of non-drug interventions that have been examined to try to treat fatigue. And the main types of these are education programs, exercise and physical activity, psychosocial and talking therapies, and also lifestyle interventions. So with regard to the evidence for these approaches, effectiveness for these approaches in people with brain tumor, with regard to drugs to treat fatigue, there was a fairly recent review that I've identified 3 trials that looked at the effectiveness of different drugs in reducing fatigue, and they found no evidence for their effectiveness. So at present, we don't have any evidence for the effectiveness of particular drugs in reducing fatigue. With regard to exercise is one of the approaches that has most consistently been found to be effective at reducing fatigue in people with other types of cancers. And there is evidence emerging for people with primary brain tumor that exercise can also be helpful in improving fatigue, and particularly for supervised cardiovascular and resistance training. With regard to the psychosocial and talking therapies, there's also some evidence beginning to emerge that cognitive behavioral interventions can improve fatigue in brain tumor. And so these are approaches that focus on how your thoughts, attitudes, and beliefs can impact on your behavior and emotions. And then lastly, there's some preliminary evidence that a lifestyle intervention focusing on improving fluid intake, diet, exercise and movement, and also reducing stress can improve fatigue. So overall, we do have some preliminary and emerging evidence coming out that different non-drug interventions can be effective at improving fatigue in brain tumor, but there is a need for more high-quality trials with larger sample sizes to be conducted to continue to gather evidence for their effectiveness. There are also a number of trials that are ongoing internationally at the moment that are looking at the effectiveness of different types of non-drug interventions. So there's, for example, one looking at endurance versus resistance training, another looking at mind-body movement, and then there's another looking at cognitive behavioral therapy for fatigue that's specifically designed for people with brain tumor. And then lastly, I want to highlight an intervention that our research group based at the University of Sydney is currently developing. This intervention is called the Restore BT intervention. It is an online intervention, and it's being designed to try to help people with brain tumor learn strategies to better manage their fatigue. It will consist of 6 sessions. The first one focuses on education about fatigue. There's another on making plans to manage fatigue. The others focus on managing fatigue at home and at work. There's one on how your thoughts and feelings can affect your fatigue. And then the last one focuses on strategies for how to talk to others about your fatigue. And we will be evaluating this intervention beginning end of this year, early next year. So if this is something that interests anyone in this room and you'd like to participate, then please do come and speak to me later. I'll give you the information. So in summary, fatigue is a really common symptom that's experienced by people with brain tumor, and it negatively impacts on lots of different aspects of quality of life. We do have some evidence coming out that exercise, psychosocial and lifestyle interventions can help to improve fatigue. And thankfully, this is an active area of research. So there are a number of trials ongoing internationally, others in development, including our own. So we do hope that we'll have more evidence-based approaches to recommend to you all in the near future. So thank you very much. And look forward to questions.